There have been so many thousands of ozone treatments delivered in my practice that it's really hard to pick out one that we think of really brilliant. There were some that were spectacular, such as a horse with a systemic rotococcal infection that was resulting in immune-mediated desmitis and horrible arthritis, and this horse was literally melting in front of our eyes, you know. Ankles were dropping, fetlocks were going, looked like the suspensories were going to be completely destroyed. And I treated this mare with ozone, and her first session, she kind of looked like she had been given prostaglandin. She sweat, she looked like she was gonna colic, she laid down, she got up, but about 30 or 40 minutes later, she was up and eating hay. The next day, when she got another treatment, she sweat about half as much. The third day, she hardly sweated at all. She had been seen at the local university hospital and had been diagnosed with this, and the owner was told to put her to sleep because the damage that had been done was going to be progressive as well as sufficient to keep her from ever being a performance horse. After her 8 or 10 sessions of ozone therapy, we sent her home, and she showed at the Devon Horse Show the next year and won her class, and was a healthy horse for the rest of her life. So I think that one's pretty outstanding. And as a small animal case, I think the biggest thing that I really notice is that collectively, my cancer patients, whether they are being managed with strictly holistic or integrative care, or whether they are being managed concurrently with conventional oncologic care, that my cancer patients' quality of life is far superior to the average cancer patient. And my oncologists, my referral oncologists, are frequently scratching their heads as to why my clients' animals, the cases that we share, almost always, in fact, I can't think of one that hasn't far exceeded the prognosis of life, and indeed the prognosis of quality of life that they were given from conventional medicine. So we have an opportunity to interact and help whatever method of treatment we want to give animals, whether it be conventional care or what we call alternative care, or what I like to call integrative care. I find that ozone is the cornerstone. It is the common denominator that improves outcomes more than anything else I do.